Hello from the team at Clifton Homecare and myself, Caroline. I wanted just to take some time to give you the latest information as to where we are up to as a company providing essential care and support to people living in the community, to provide you with some reassurance where possible, and to provide you with some of the latest information and to reiterate the key points of this. We're currently taking guidance from Public Health England, and the staff are working really hard in order to maintain our care and support provision. At times, the care times themselves and duration of calls may have to change, and we're regularly keeping in contact with clients and families where this is necessary. I just want to reassure you, during these really uncertain, unpredictable and quite scary times, that we are doing our emergency contingency planning and ensuring that our care and support provision continues for certainly our clients that are most at need. We've got our stock of PPE and hand sanitizer, albeit a limited stock, and we are working with our suppliers to keep that provision going, and again Public Health England to restore the items that we don't usually have in stock. We're updating our staff and clients regularly via face-to-face briefings, although they are reducing in number, email, which is most days, and WhatsApp group for latest information or key points. We're providing them with necessary training. They're all taking a grip of the situation. They all know that they must prioritise hand hygiene, using hand sanitizer before they enter properties, and washing their hands routinely during visits, and then sanitising on exiting of the accommodation as well. We're liaising with families, keeping families and clients updated via email and telephone calls for those who don't have email provision. If you don't want to receive those emails as frequently, please let us know. But it's just to make sure everybody's kept up to date as to where we are at as a provider. We are potentially looking at remote working for the admin staff. We have got the capacity to continue. We've got the equipment necessary, and the staff team will work flexibly with that. The care staff, however, will be continuing to provide the care and support provision in the community. However, we have stopped non-essential trips out into the community, such as shopping. The current guidance for vulnerable groups, and the vulnerable groups are people over the age of 70, people with long-term conditions, people who are pregnant, and people with immunosuppression, is to socially distance yourself from others. So that's not to attend places like supermarkets, social gatherings, coffee shops, etc. And this is a really key, important piece of advice from Public Health England. And there's many reasons for that, which we won't discuss here, but please contact us if you want to discuss that further. That really needs to be followed where possible, and we're not saying you can't go out and get necessary food provision, but please liaise with us if you're struggling with that. We are asking members of the community, if they want to help, to contact us via email if possible in the first instance, which is Clifton, CLIFTON, HCL@gmail.com, or alternatively you can use our telephone number 01253 722 945. People where they do volunteer their time will be paid, and it's just to help us provide service continuity really, and that's due to staff shortages due to the 14-day whole household isolation period now, but also if staff themselves become sick. And I just want to reiterate there, we are doing our best to keep everybody, all our staff, all our clients and all respective families safe where absolutely possible. But please, please, please adhere to the guidance. It's there to keep not only yourselves and your family safe, but our team, which are necessary in the coming weeks and months. And if you're contacting the office, if you're contacting the admin team with non-urgent inquiries, please bear with us. Again, if you can use the email in the first instance, we can pick that up remotely far more easily than if you use the telephone number. But if it is an urgent or an emergency, then obviously ring us in the first instance. Thanks for your time, and I'll continue to keep you all updated. And in the meantime, keep yourselves safe, and please socially distance yourselves if you're in one of the vulnerable categories. Thank you.